New at 6, Children's Hospital Colorado is taking precautions now as the number of RSV cases continues to skyrocket. It comes after more than 360 people were hospitalized from the 5 metro counties during October. About 95% of those cases were children. Our Connor McHugh live at Children's Hospital right now. And Connor, patients might notice a new overflow tent.
Yeah, Jim, this overflow tent here at Children's Hospital was first used early on in the pandemic as a way of helping patients with acute medical needs while more serious cases were handled inside the hospital. Now, for the first time, that tent is back out again, but this time it's because of a rise in RSV cases. Now, this decision comes as the hospital system is facing a significant increase in children requiring inpatient admission. So much so, a spokesperson tells us most of their emergency departments and inpatient units are full on a daily basis these days. Now, because of that, Children's Hospital has enacted its strategic capacity and surge protocols. That includes increasing staffing and using the tent to avoid overcrowding. The hospital is also postponing some procedures and rescheduling some admissions that are not emergencies at this time. Now, last week, we spoke with one clinician here who is working on the Pfizer RSV vaccine trial. He's hopeful it'll get approval and we will not see a fall wave like this again.
Depending on what happens, if the licensure of the monoclonal antibody happens before June, July, then, and the ACIP makes its recommendations, we should have prevention next year. I'm really hopeful.
Now, the state says high levels of RSV transmission in the community are expected to continue for the next several weeks. They also say that if your child is showing some early signs of distress or symptoms of RSV, to first call your pediatrician or primary care doctor before going to the emergency department. Live in Aurora tonight, Connor McHugh covering Colorado First.